Good morning everyone. I am Dr. Sandeep Janardhan Tandil. I am a general and laparoscopic surgeon. Today's topic I have taken is about a salivary gland, benign tumor of a salivary gland, and the name is the pleomorphic adenoma of the parotid gland. Now why it is called as a benign? Because it is not cancerous. It usually do not spread to the other part of the body. And why it is called as a pleomorphic adenoma? Pleomorphic means variable appearance. This tumor or this swelling of the parotid gland will have the cells inside the that swelling will have different appearance. That's why it is called as a pleomorphic adenoma. Now pleomorphic adenoma can occur is common benign tumor among the all salivary gland tumors, and it is around 45 to 75%. Females are the most commonly affected, even though it can happen in the males. What are the risk factors for developing the pleomorphic adenoma? The risk factors are if there is a history of radiation to the head and neck region. Radiation is a radiation treatment if it is taken in the past. If a patient is having any type of addiction to the tobacco, then infection with a virus, simian virus 40, exposure to certain chemicals and certain chromosomal aberrations, that is some genetic condition which can cause the formation of pleomorphic adenoma. Now we will go for the symptoms, how patient will present to the doctor. The patient will be presenting with a swelling in the front of ear or in just below the ear, which is called as a parotid region. If you have seen my previous video, I have described what is a parotid region. So patient might present with a small swelling which will gradually, that is, it will slowly increase in size. Sometimes it can rapidly also increase in size. This is the most common symptom. If you delay going to doctor, this swelling will keep on growing and it will become such a large swelling. It can cause the trouble for opening mouth also. It can go deeper inside, and then the skin also will become very thin and it can become necrosed. The other symptoms which patient can present is if the swelling is compressing the facial nerve. There is a nerve which is closely associated with the parotid gland, and this swelling or tumor can compress the nerve and produce the symptoms due to the compression of the nerve. Like the facial nerve supplies to the muscles of the face. So the ballooning of your cheek will get affected. Closing your eyes might get affected. Smiling, the lips may not properly open up. It will deviate on one side if the nerve is involved. Whichever muscles the facial nerve is supplying can get affected. It happens when the swelling or this tumor is involving the facial nerve or compression has happened. These are the common symptoms. So go to doctor to check. The doctor will examine this area and he'll try to examine the swelling, its size, what is the location of it, whether there are any other swellings in the neck. Like he will also check for the lymph nodes. I have described about lymph nodes in my previous video. Then he will check for the opposite side of the parotid. Doctor will check inside your mouth to check for the opening of the parotid gland duct, that is a Stenson duct. If there is any infection, if it is blocked, if there is any stone, all this examination doctor will do to come to a diagnosis, a differential diagnosis of the pleomorphic adenoma. Now how doctor will diagnose this, further diagnosis? Now after clinical examination, doctor will ask you to do certain investigations. Now the most common investigation done is the sonography. In sonography, doctor will identify it is a parotid gland, what is the size of the tumor or the swelling inside, then how deep it is, and if any other blood collection or pus, doctor will describe. The next investigation which can be done is a CT scan. CT scan will help in diagnosing whether deeper extension of the swelling is there or not, more better than sonography. Third investigation of choice is MRI. That is, MRI is a choice of investigation because it helps in diagnosing and identifying the size, depth, the nerves, all those things we get a better picture with MRI. Then fine needle aspiration cytology, FNAC. In FNAC, doctor will aspirate some fluid from that swelling or some cells from that, and the doctor will check under microscope to find out whether it is benign or it is malignancy. Malignancy means whether it is cancerous or not. It's important to know whether it is benign or cancerous because there is a small risk of parotid pleomorphic adenoma to get converted into the malignancy. So it is always advisable that when the swelling of this pleomorphic adenoma is diagnosed or identified, excision has to be done. So next investigation is immunohistochemistry. That is, certain chemical test will be done on the fluid or the aspirate or the biopsy if it is taken to further confirm that it is a pleomorphic adenoma. Now the treatment for the pleomorphic adenoma. The treatment for pleomorphic adenoma is mostly surgical. There is no medical treatment for this because once the pleomorphic adenoma is confirmed on the FNAC, better to remove that swelling. Okay, so the treatment is superficial parotidectomy and total parotidectomy. Now, when superficial parotidectomy is advised, the parotid gland as such is having two parts, superficial and the deep lobes. If you have seen my previous video, I have described the anatomy. So now if the swelling is this tumor is in the superficial lobe of it, the doctor mostly will prefer for superficial parotidectomy. That means that superficial lobe will be completely removed. Taking care of the facial nerve. This surgery is mainly important because of the facial nerve. The facial nerve is an important nerve which passes in between this gland, like superficial and deep lobe, and it supplies with the muscles. They are very thin branches with very thin nerves. So doctor will always try to make sure that the facial nerve is preserved. There are the new technologies available like facial nerve monitoring, which will be used if it is available to monitor if while doing surgery the nerve is very close while removal. Then treatment is a total parotidectomy. Now total parotidectomy is done if the deep lobe of the parotid gland is involved, or if it is suspicious, if it is malignant swelling, then total parotid will be removed. Again in this procedure, doctor will try to preserve the facial nerve. In case the facial nerve is involved due to the malignancy, only the doctor will take a decision of removing or reconstruction that part of the facial nerve. But in most of the cases, doctor will try to preserve the facial nerve. Now after this, the next treatment, if required, like radiation treatment. Radiation treatment is given if the tumor could not be completely removed. Like in certain cases, like elderly patients who are not able to undergo surgery, the radiation can be given. In cases the tumor cannot be completely removed during surgery due to any reason, like if it is too much adherent, like it is stuck to that area, facial nerve is involved too much, in that situations also radiation treatment can be given. If there is the margins, when the surgery is done and the tumor is removed, if there is a suspicion that some margin is remaining of the tumor, then radiation can be given in such cases. Also in the recurrent swellings, recurrent pleomorphic adenomas, the radiation treatment can be considered. I think doctor will take decision about such treatments after discussing with you. Now after surgery, next question comes is what is the recurrence rate? Does this swelling comes back after removing? So if it is not completely removed, like if it is removed, complete superficial lobe is removed, risk of recurrence is less, but there is always chance of up to 23%. There is a chance of recurrence because of this pleomorphic presentation, and this swelling usually will be involving the surrounding the normal parotid gland. There is a chance that it can come back. In that situation, again surgery might be required. Recurrent parotid surgeries are little more difficult, as after any surgery that area will get fibrous, it will get stick to that area. So this is how the treatment for parotid pleomorphic adenoma is done. Thank you for listening to my video. Thank you very much. If you have any doubt, please mention in the comment box. Thank you very much.